name's Pauline, and thank you for meeting up with me today and taking the initiative to actually come up to me and learn more about how to properly administer naloxone.
Yeah, so the other day I actually had like a very traumatic experience where I saw someone having an overdose and I just didn't know what to do, and I thought maybe by having this education it could help prevent future individuals from having overdose, and I would know what to do right away.
So I'm really willing to help you out with that and hope you could learn something today.
Thank you.
All right, so just to start with, I'll go over signs and symptoms of opioid overdose, so that you would know when to give naloxone. So first, the main thing you have to know about is respiratory depression. So what that looks like is one breath every 5 seconds or less. And some other symptoms you also have to watch out for would be decrease in body temperature, so the skin would feel clammy and cool. And then there would be unusual sleepiness, and it would be difficult for them to wake up. And you probably would notice blue lips and nails. And also lastly, there would be hypotension or low blood pressure. Yeah, so if you forget about those signs and symptoms, I would give you this pamphlet. You could go over that. Okay, so before you move on to the next part, are you able to restate to me the signs and symptoms of opioid overdose?
Yeah, so some of the signs and symptoms that you mentioned were less than one breath every 5 seconds. Their body temperature might be cold. Their skin may appear cool and clammy. You may notice a bit of blueness in their lips and nails. And then I think you also said hypotension, so low blood pressure.
That's right. All right, good job, team. So we'll move on to the next part, but before we learn how to properly administer naloxone, we'll just go over what's inside and familiarize what's inside the naloxone kit. So you can open it with me. So first we have 3 syringes, 3 ml syringes, and then 3 ampules of naloxone inside.
Oh,
yeah, very important.
Yeah.
And there's also a CPR barrier shield. So if we need to give breaths to the patient, then we have to use that. All right, so we'll move on to the next part. So I'll show you how to properly administer naloxone and how to drop the medication out from the ampule. So what we need first would be the ampule with the naloxone inside, your syringe, the alcohol swab, which we need to cleanse the skin before injecting, and then gloves to wear, but in an emergency situation, we can skip this part. So I'll pretend it's an emergency situation, so I'll show you so I won't be wearing that. So I'll show you how to drop the medication from the ampule. So first, before you break it and open it, you have to make sure that there's no fluid on the neck part. So you have to bring everything down the body. So you could either do this, so you slide it here on the surface, or you could do like the revolve around the world technique. So either that or that one would work. So you can see that everything's in the body now, nothing's on the neck part. So now you just have to break it open. So you have to break it away from your face. So like this. Okay. Then drop the medication from the ampule. So just take everything out. That. Okay. And you want to cap that back in. One thing you have to make sure though is that there's no air in the syringe. So you could either tap that like this and bring all the air up, and then just push it. So push the air out of the syringe. And that one's done. So that one's ready. So I showed you how to draw the medication out from the ampule. So are you able to demonstrate how I did that?
yeah.
I could walk you through it too if you need help.
Yeah, so you said 1 ampule, and then a syringe, and then also gloves, but in an emergency situation, we don't have to use it.
Yes.
So then with the medication, you said to from this motion to get the medication out from the neck, or I can do the revolve around the world. So let me just do that. So no medications are in the neck, and then you said to break it away from yourself. Okay.
Good job.
Thank you. Cut hard. And then the syringe. And then you pull the cap off. And then to draw up everything. Perfect. So then I would cap it back on like you said.
Yes.
And then with the air, I would just push it out. And then if there's any air bubbles, which I see, you said to just tap it to get it out. And then once those bubbles are out, just push it out with the syringe as well. Okay, I believe this one's ready to go.
Good job. Okay, so we'll move on to the next part, which is to how to properly administer the naloxone to the client. So first thing we have to know is which areas we could inject the naloxone. So the areas would be your large muscles, which are your upper arms, your thighs, and your outer buttocks. So we'll pretend that your orange is the large muscle. So, we have an alcohol swab here, which we could use to disinfect the skin area. But in an emergency situation, feel free to skip that part because we're in a hurry. So now I'm gonna pretend that this is your large muscle, and I'll show you how to inject the medication in. So you'll take your syringe out, and then you have to angle it in a 90-degree angle, and then you just inject it on the client's large muscle, and then push everything in, administer the dose, and then after that you have to engage the safety. It's done. So you've engaged the safety cap. So now I'll let you demonstrate what I did.
Okay.
And then if you get confused in the middle, I could just also walk you through it.
Okay, sounds good. So you said the sites to inject them is usually your large muscles, so your arms or your thighs, and then your outer buttocks. So then we can use an alcohol swab to cleanse the area. However, in an emergency situation, we don't have time for that, so we're gonna skip that. So locate the area. Let's say this is the upper arm. I'm gonna do it. So uncap the syringe with the naloxone, and then you said 90-degree. So right here, I'm gonna push it in, and then inject the medication in there. And then once that's done, I can press it to engage the safety cap so I don't poke anyone. And that's it.
Okay, good job. Have to learn about the abbreviation SAVE ME, so that one's very important to learn about. So S means to stimulate, so we have to stimulate the patient, check for pain response, and at this point you have to call 911.
Okay.
Then next step would be A, which is airway, so you have to check the inside of the mouth of the patient and then open their airway. And the next step is V, which is ventilate, so you have to give rescue breaths to the client if needed. And then next step after doing that, you have to evaluate and see if the patient started breathing on their own. But if they haven't yet, then you have to move on to the next step, which is to give the medication, so add medication, so you give them naloxone.
Okay.
And after giving and administering that medication, you have to evaluate again, so that's important. As well, check if the patient has started breathing on their own.
Okay.
Let's try to go over again what SAVE ME means.
Okay.
So S.
So stimulate, so you would use your voice or pain and just be like, hey, can you hear me? And then at this point you would call 911.
Yeah. And then A.
So airway, you would check their mouth to see if there's anything in there that's obstructing their airway.
And then V.
V is ventilate, so give breath if it's needed. Yeah.
And then E.
E is evaluate, so check to see if the person has started breathing on their own.
Yeah.
Yeah.
And then if they haven't, we move on to the next step, which is M.
So medicate, so like what we did with drawing up the syringe and the medication, we administer the naloxone.
And then next E.
And then the last step was evaluate again, so we would check to see if the person has started breathing on their own.
Yeah.
And if they haven't, we could give another dose of naloxone until the medical services arrive.
Yes, that's right. Good job.